Hello, ladies. I'm here today to talk to you about the importance of going to get a mammogram done. A mammogram is an X-ray exam of the breast that looks for changes that are not normal within the breast. After the mammogram has been done, the doctor has a closer look for the changes within the breast tissue to see if anything is abnormal. Women who have no breast complaints and women who have breast symptoms all need to go get a mammogram done, especially the women with breast symptoms. If you have any symptoms, it's a great deal that you could have breast cancer. If you have no breast symptoms, it's also important that you go get a mammogram done because you never know. You could be in the developing stages of developing breast cancer. Also, too, a mammogram detects breast cancer early. The benefits of a mammogram is great. A mammogram detects and finds breast cancer early, and with that being said, it improves a woman's chances for successful treatment. A mammogram also shows lumps or masses, cysts, fibroadenomas, and calcification. A mammogram lowers the risk of dying from breast cancer by 35% or more. That is a big number in percentage wise with lowering the risk of dying from breast cancer. Breast a mammogram also can detect breast cancer early, and a woman does not have to have her breast removed. So that's very good. A woman can, go get the mammogram, and if it's found that she does have or in the developing stages of breast cancer, she doesn't have to get her breast removed. And many more women are able to keep their breasts with that if it's detected early. There are a number of risk factors for developing breast cancer. The most important risk factor is age. The older a woman is, the greater her chance of developing breast cancer. Also, the family history increases. If a mother, a sister, or daughter has been diagnosed with breast cancer, you have a great risk factor increase in developing breast cancer. Also, having a close male relative with breast cancer increases the risk factor. The more alcohol a woman drinks, the greater her risk. So the less alcohol you drink, you can reduce your risk of developing breast cancer. Your personal history. A woman who has breast cancer is more likely to develop breast cancer a second time. Your breast density. Women who have a higher percentage of breast density tissue have a higher risk than a woman of similar age who has little or no dense tissue in their breast. Body weight also increases the risk of developing breast cancer. After menopause, especially those women who are overweight or obese, you have a higher risk of developing breast cancer. Women who had radiation therapy to the chest before age 30, you have a greater risk of developing breast cancer. The younger a woman receives treatment, the higher risk of developing breast cancer later in life. A woman's first menstrual period before age 12, or if a woman went through menopause after age 55, is a risk factor for developing breast cancer. First full-time pregnancy after 30, or never had a full-term pregnancy increases the risk of breast cancer. Women who are physically inactive throughout life, being active may help reduce the risk of preventing weight gain and obesity. I talked about obesity and weight earlier. That is a great risk factor in developing breast cancer. The recommendations for getting a mammogram: when women with family histories of breast cancer or other risk factors start as early as 30. So if you're 30, it doesn't matter if you're 30 or younger. If you're 30 or older, it's best that you go get a mammogram, especially if you have a family history of breast cancer. Women age 40 and older should have mammograms every 1 to 2 years. That is very important that you go get your mammograms done. You never know. You might be in the developing stages of breast cancer. Women who are higher than average risk of breast cancer should talk with their healthcare provider about whether to have mammograms before age 80 and how often to have them. So, I mean, if you're younger than 40, if you're younger than 40, it's best that you talk to your doctor, especially if you have a family history of breast cancer. Being that said, I spoke about everything dealing with breast cancer. I talked about what a mammogram is. I talked about the benefits of a mammogram, the risk for developing cancer. Take into consideration all that I have talked about today. And you go home, and I hope you really think about everything, because it's a lot of risk factors out there that can cause breast cancer, and a mammogram would definitely help in preventing breast cancer. And I thank you today.